Good morning, this is Dr. Farley. I want to go over a few things in this video here. One, about the concept of healing, what is healing? And number two, about your allopathic medical diagnosis. So the first thing to understand is that we do not treat any allopathic medical diagnosis. We leave that to your medical docs. They have one tool. The tool is normally a drug, and that is the story. So the diagnosis is usually not very specific or individualized. For instance, I could have 3 Parkinson's patients given the exact same drug, and yet this guy is a diabetic and 50 pounds overweight. This person hit his head 16 times, and this person over here did drugs, prescription drugs, and took 35 rounds of antibiotics. Very different patients treated exactly the same. That's protocol cheap care. That's what I call that. Protocol cheap care, meaning it's not individualized, and it's the easiest way to basically listen to the patient and push them out the door. So years ago, when I first got into practice, there were the HMOs were coming around, and I remember back then this is where the beginning of the cheap care started. No longer did doctors listen, no longer were they concerned about each individual patient, but the bottom line is all the medical doc has is this. That's it. It's a drug. So some of you may not want to do that, don't do that, won't do that, and that's fine. That's your prerogative to take care of your health as you see fit. What you do want to know is that when we use the drug cannot and does not restore health because it does not restore function. It may manage a symptom, but it doesn't restore function. So what's the goal of my program here in the neurobiomedicine functional restoration program? So the first thing is, it doesn't matter to me your diagnosis. I will do my assessment, I will look at my paperwork, and I will do my testing, and if the case qualifies, run blood work and specialty blood work, and I will help you correct your functional imbalances. We do that through many different ways, but I will help you correct those functional imbalances. And then we now have a baseline to say this is what was not functioning, working properly, which is what your health is, how you function, not how you feel. And then ultimately, we're trying to influence the function by doing functional treatments. So that is the only way to restore function. That is the only way to improve healing. Now let's talk about healing for a second. What is healing? What is it? What are we trying to do? Are we just trying to get rid of the ache or pain? Are we trying to get rid of our bad mood? Are we trying to get rid of our skin condition? Or are we trying to understand what healing is? Healing is the ability of our cells that are constantly turning over to turn over a better quality cell, or at least an optimal quality cell. When you see diseases or disease and someone breaks down, it means that the ability of the cells to turn over has been compromised. That happens from a high allostatic stress load over years and years and years from the different stressors. And over a time frame, now we have improper cell turnover. So let me just give you some ideas here. Your small intestinal epithelium, you will have turnover in 2 to 4 days. Brand new small intestinal epithelium. Your stomach, 2 to 9 days. Your blood neutrophils, which is a white blood cell, 1 to 5 days. Your white blood cells, eosinophils, 2 to 5 days. Your gastrointestinal colon crypt cells, 3 to 4 days. The cervix in a female, 6 days. Your lung, 8 days. Your taste buds, 10 days. Platelets, 10 days. Bone osteoclasts, 2 weeks. Intestinal panther cells, 20 days. Skin, 10 to 30 days. Your pancreas beta cells, 20 to 50 days. B cells, 4 to 7 weeks. The trachea, 1 to 2 months. Stem cells in your bone marrow, 2 months. Sperm, 2 months. Bone osteoblasts, 3 months. Red blood cells, 4 months. Liver hepatocytes, 0.5, 6 months to 1 year. Fat cells every 8 years. Cardiomyocytes, you get about a 10% turnover a year. Your central nervous system does not regenerate. The skeleton's about 10% a year. Your lens in your eyes don't regenerate, and the female gametes don't regenerate. But everything else regenerates. So what are we trying to do? Well, we're trying to take an individualized physiology, and biochemistry and influence it in the right direction by identifying the stressors creating the abnormal allostatic stress load. And then guess what starts to happen? The cells turn over at a better quality rate, better quality rate, better quality rate, better quality rate. That is healing. That is the objective of what we are doing. We are not treating any disease. We are not treating any symptom. We are trying to influence the ability of cells to turn over better and improve function. We use anatomy, physiology, and biochemistry. So with that said, that's the goal. And the other question that people have over a time frame too is, well, what starts to happen? Well, let's just say this, that one more thing also. By the time you get symptoms, you have 85% damage to your cells. 85%. And if your symptoms show up first as a thyroid issue, or first as depression, or first as a tremor, it usually means the entire body and brain is broken down 85%. That just happens to be the first group of symptoms. So this is a very sick system that you're dealing with. So people come in all the time kind of shocked. Well, I'm so-and-so and I just have a foot problem. No, you don't. You have a health problem. I just have a stomach problem. No, you don't. You have a health problem. I just have a sleep problem. No, you don't. You have a health problem. And this health problem, again, is not isolated to one individual area. That may be where the symptoms are, but that's happening all throughout every cell throughout the brain and the body. So the goal, again, is to, through proper testing, identify the gears, where are the functional disturbances, and then go to my toolbox, and my toolbox has a lot more in it than a drug, way more in it than the drug. And go to my toolbox and try to influence those mechanisms as best we can. And again, we use the science of anatomy, physiology, and biochemistry. And by using that, this is a science evidence-based approach to restoring function. And over a time frame, we can see very positive changes. Now, for one person, they may have a huge improvement in a symptom, someone else not such a huge improvement in a symptom. So we're not here to tell you that we're going to magically wave a wand and cure your disease and get rid of all your symptoms. That's snake oil. This is what's being pushed by the drug companies over and over again, that somehow they're going to come and cure all these diseases. Well, here's the thing. If we don't address function, it will never happen. It can't happen. It's a myth. It's kind of like saying, from where my office is here in central northwestern New Jersey, if I drive north, when will I hit the Jersey Shore? The answer is you won't. It doesn't go that direction. The same thing with your health. If all we do is manage the symptoms with drugs, it's like driving north to try to get to the Jersey Shore. Won't happen. Can't happen. It's impossible. So, drugs are managed by your doc. I do get involved. I have conversations with you and conversations with the doc if we need to, and he or she modifies all medication, nothing to do with me. They're treating disease. We're looking at functional issues and trying to improve the healing, which is the cellular turnover. And if you continue to do this on a timely basis, you can get higher levels of function and higher levels of function. So that's what we do. But I think it's important to understand the concept of what healing is not. Symptom management, disease management is not what we're doing. So we work much deeper. We work much more on foundational ideas. And we make individual plans based on individual testing. So protocols are passé. They don't work. This is why they don't work. Because we have individual people with the same medical diagnosis, but each person has individual causes for that medical diagnosis. So we go deeper. We understand your anatomy, physiology, and biochemistry, and we try to do our best to educate you, number one, understanding your allostatic stress load and your specific stressors, and then set up and devise a plan to restore or improve and optimize cellular turnover, which is to allow proper and better healing, and I call that creating healability. So thank you. If you have any questions, as always, please let me know.